This video is going to demonstrate to you how to insert a catheter on a male patient. Before you ever enter your patient's room, you always want to make sure you have the appropriate supplies ready so that you have everything you need when you get to the room. The first thing I want you to grab is always going to be a towel and washcloth. This way you can provide perinatal care to your patient before you insert the catheter. I also want you to grab a sheet or an extra blanket to keep your patient covered. That way they won't get cold and it'll maintain privacy for your patient. Next, you want to get your Foley catheter kit. You want to select the appropriate size and the appropriate catheter for your patient and their situation. Personally, I like to grab an extra pair of gloves in case I contaminate, but also because the particular Foley kit that I have has a smaller size gloves than what I need. Finally, if you're unsure if your kit has a catheter securing device, you want to get one of those to attach the catheter to your patient's leg after insertion. Once you gather your supplies, you can enter your patient's room. You always want to shut the door behind you when you enter your patient's room and pull a curtain if it's not a private room to ensure privacy for your patient. At this point, you would want to explain to your patient what the procedure was, as well as asking them their name and date of birth to ensure you have the correct patient, and asking them about any allergies before you proceed. You also want to make sure that you wash your hands upon entering any patient's room, regardless of what you're about to do. When you do your return, we'll expect you to discuss with your patient everything that we've mentioned. You may not see me doing that in this video, however, because it's simply a video to show you the technique and explain the procedure to you. I'm going to move this table on the opposite side of the bed from where I'm going to perform the procedure. Because I'm right-handed, I'm going to stand on if I'm looking from the foot of the bed, I'm going to be on the left-hand side of the bed to ensure that my dominant hand is the one that's going to insert the catheter.